Welcome everyone to today's webinar hosted by Prevention Plus Wellness LLC, located here in beautiful St. Augustine and historic St. Augustine, Florida. My name is Dr. Chudley Wirch. I'm CEO and founder at Prevention Plus Wellness. And today we've got an hour's worth of strengthening drug prevention with data collection. So we'll be talking about things related specifically to the data collection of our programs, but implications for whatever prevention programs, interventions that you're using wherever you may be in the country. So I just wanted to check the chat space and see who's on. I just get the biggest kick out of this to see where people are signing in from. It's amazing, I think, to see that we're able to use this technology to all share this time together. By the way, we will have time at the end of today's session for questions and answers, Q&A, so you can find that Q&A option on your toolbar, and if you have a question or comment, do put it there so it doesn't get lost in all this other information in the chat space. So find Q&A on your toolbar if you have a question or comment. I'm assuming you can hear me and see me because everybody is signing in and introducing themselves. So you can see if you scroll down like I'm doing right now, I just want to see where everybody's coming from. We got people from Georgia, and we have people from Georgia, which is just up the road, and South Carolina, which is up the road a little bit further. Nebraska and Tennessee, which is amazing. Michigan and Missouri. I'm reading this as quickly as I can. Pennsylvania. A lot of Midwesterners today, which is amazing. New York, which is great. Let's see where else people are coming from. More South Carolina, all the way from Texas. As I said, New York, more from Texas, Nevada. It's New York, I'm sorry. And LA, Los Angeles, Missouri, New York, Tennessee, more Texas, more Tennessee, Texas. We're having a countdown who's going to be more Tennessee or Texas today. More PA and Utah, yay. And Tennessee, I think, won. Alabama, fantastic. And more Tennessee. Gosh, we're having a lot of people from Tennessee, which is cool. All right, I'm going to stop. Otherwise, I'll be spending the whole time going over this, which I really enjoy. So this is being recorded. I will set this up on our website and send you a link today. You will be able to have the recording of this webinar. You can share with your colleagues and friends and state coalition members, etc. And I'll send you the links, or I'll post the links and the CEU certificate. So let's dive in, because I think there's quite a few slides here I wanted to show you. There's 4 objectives for today's session. You'll be able to identify purposes for monitoring, and I can't really see, evaluating, there's my toolbar is in the way. Substance use prevention, monitoring, evaluating prevention programming, describe data collection tools and some measures to assess prevention plus wellness programs, but also give you some ideas as to, if you don't use PPW programs, how you can these kinds of measures to measure whatever prevention intervention program you might have in terms of quality, fidelity, and outcomes. Thirdly, examine evaluation design for determining both risk and protective factor, as well as behavioral effects from your prevention intervention. And then lastly, blue box down below, to explore how to compare pre-post data. So that's something we do in particular for our providers, our clients throughout the country and abroad, And so we'll show you that. I think that's very useful for all prevention providers of whatever prevention program you're using. Before I go any further, I do have a very brief poll, just 3 questions, just an introductory poll. Let me pull that up for everyone and let you go ahead and participate in that. If I can find it. There we go. There it is. I'm going to launch it. You'll see it in just a moment. You'll need to scroll down because there's 3 questions, so you may not see all 3 at once. So as soon as you get this, please take a moment. And if you are online and you have that ability to answer these, please do that. So there we go. Let's see. So first question, have you ever implemented a PPW, that's Prevention Plus Wellness Program? You've got some different responses there. Question number 2, again, you need to scroll down to see that. What types of prevention program messages are you most interested in collecting? What types of prevention program measures are you most interested in collecting? My glasses aren't working today. Number 3, lastly, what barriers or problems cause you to not want to evaluate your prevention program or a prevention program? So those are the 3 questions. You just have a moment or 2 to answer those. The more people that answer, I think the better understanding we have of who's online, so we can tailor today's training a little bit to you, and then we can just understand who's online and who's participating today. So we got 61% that have participated. I'm going to wait just another minute or so to get everybody a chance who wants to. It's up to 66% now, which is great. Usually we like to cut it off at about 70. So we're at 66. So we'll just wait till there's another couple more of you, few more of you to participate. We're up to 69% already. So we're almost there. So another 30 seconds to let people that can answer these questions and let them go ahead and do that. And just another few more moments. We're almost at 70%. We are, yeah, 70%. Fantastic. So I'll give you that last few seconds for those last people that hopped on to answer these questions and let them go ahead and complete answering all 3 questions. You're already up to 72%. That's amazing. 7 out of 10 of you online have answered the survey questions, which is fantastic. Thank you so much for participating. You're wonderful. So I'm going to shut down the participation. I'm going to share the results. They're coming your way. You'll be able to see them here in just a minute. And the first question is, have you ever implemented a PPW program? And actually, most of you, the majority of you, 54% said no. So this is a great opportunity for you to learn more about PPW programs through evaluation. So we won't be speaking a lot about PPW programs, but if you want to learn more, go to our website, preventionpluswellness.com. Preventionpluswellness.com. So most of you, 54%, said no, you haven't implemented a program, but we do have 20% said you hope to in the future, which is awesome. And then number 2, what types of prevention program measures are you most interested in? The greatest percentage, 65%, said program substance use behavior changes. Of course, that's really the ultimate goal for prevention programs is, are we having an impact? By the way, not just prevention programs, any program, awareness programs, education programs, media campaigns, whatever we do, whatever we offer, whether that's individual, family, community, environment, whatever, we want to have an impact on substance use behaviors, that is to prevent or slow the initiation of use, to reduce use, to reduce misuse and problems, etc. But related to that, and you can see the results behind that, we want to measure risk and protective factors, which are a precursor to, at least theoretically, to the substance use behaviors. And thank you, almost half of you, actually over half, 52% said healthy behaviors Measuring healthy behaviors are important to you, which do help reduce substance use and improve mental health. So I think there's, because of us, and I think um, other providers and researchers that are focused on positive youth development and broader wellness applications of prevention, realize that we need to have a broader scope, looking at something other than just substance use, and this includes healthy behaviors. Quality of program implementation comes first. If you don't implement your program with quality, you're not going to necessarily see outcomes. And fidelity, which is an issue for all evidence-based programs. Again, similar to quality of implementation, if you don't implement your evidence-based program with fidelity, you're less likely to see outcomes. Last question, what barriers do you guys see or problems that would cause you not to want to collect data? And the number one is lack of training and program evaluation. Wow, I'm sort of surprised by that. 50% of you said that. So I'm glad we're having this training for you today, and this will help you, I think, and that gives me some ideas. Maybe we need to have some more training. If you think we need to have more training, if you need more training, give us some specific ideas for that in the Q&A space, or you could email me at info at preventionpluswellness.com. That's how you can reach out to me directly, info at preventionpluswellness.com. Or you can type in your ideas for what kinds of evaluation training you need in the Q&A space, and we'll talk about that. Also, lack of data collection tools or survey, and we have those built in our programs. And then none or others. So there's actually a quarter of you said none or others, which would be interesting to know what that is. So if you can open the Q&A space and let me know what you're talking about for none or other barriers to prevention. Lack of time, only 11%. Fantastic. Thank you so much for sharing. I really appreciate that. That was very insightful. Now let's just dive in and look at purposes for monitoring and evaluating substance use prevention programs. Here are 7 that I was able to come up with. I'm sure you may be able to come up with some others, so I'll ask you that in a minute. Number 1 that I came up with, simply to track the quality and fidelity of program implementation. Again, like I said, if your program is not implemented with quality and with the fidelity or reliability that it's supposed to as it was developed, especially when we're talking about evidence-based programs, you're not necessarily going to see the outcomes in substance use prevention, for example, or substance use behaviors or healthy behaviors that you would hope to see. Number 2, assess program outcomes. That could be risk and protective factors, that could be substance use behaviors, health behaviors, etc. Number 3, provide data for decisions about implementing and improving your program over time. In other words, you want to see what's working, what's not working, so you can continue to let your program evolve over time. Very important. Number 4, collect feedback to promote your program. We don't often think about that, but promoting your program to key stakeholders. Who are key stakeholders? Funding agencies, families, communities, prevention providers, etc. Very important to give them that feedback. Number 5, sustain your program by collecting data. You'll have data-driven decisions and more likely to sustain your program over time. Number 6, contribute to the evidence base in the prevention, substance abuse, and health behavior fields. And lastly, you have to. Sometimes we're just mandated. We have to collect data for our agency, for a funding source. And those are some really all very good reasons for collecting data, monitoring and evaluating your program. Are there other reasons that you might have for collecting data on your prevention program? If you have an idea, type it in the chat space right now. Type your ideas if you have other ideas for why it's important to collect data on your prevention program, go ahead and type it in right now. I'm going to see if anybody's will share success with community. Very good from Heather. Thank you, Heather. Any other reasons that we may have covered most of them, if not all of them, but apparently not all of them, because Heather had the great idea of sharing success with your colleagues, with your community. So that communication, very, very important. Jeff says needs assessment. So really the front end, your pre-tests, your pre-surveys, also important as needs assessment. So very good. That's a great idea as well. Accountability, also good. Community level trends to track school level, community level, student level, whatever level trends over time. In other words, repeated data collections will help you do that. All great ideas, really. Parents also should know what the outcomes are. So communicating with others, stakeholders, including parents. I'm going to stop at this point. Thank you, guys. Great examples. Great ideas. So PPW program, data collection, tools and measures. This is what we offer in our programs. So even if you're not using PPW programs, you'll get some ideas for data collection tools for your prevention programs, whatever you've been using now, currently, or in the future. So risk and protective factor, pre and post, immediate pre and post surveys. This measures outcome. The outcome is risk and protective factors. I'll describe those for you in a minute. And since most of our programs are just one 45-minute session, we're talking about implementing the pre-test immediately before the lesson, launching and completing the lesson, and then doing the post-test, all within that one period. And that's very efficient, and it's very focused on your prevention program with your participants in your setting. So it's very focused, and that makes it very valuable information for you, information that you may never have had before as a prevention specialist as to how useful your program is with regard to risk and protective factors. Number two, another measure is the health behavior survey. That's our follow-up survey. We call it 1 to 3 months. So follow-up survey. So a survey at the end of the semester, at the end of that period, which measures behavior. This is where we can measure both substance use behaviors and healthy behaviors. So you've got number one, immediate pre-post survey for risk and protective factors. Number two, a follow-up end of semester health behavior survey to assess substance use and other healthy behaviors. An instructor survey, which is a process/quality assessment, which we include, and a fidelity checklist to track fidelity of implementation or reliability, or are you implementing PPW evidence-based programs as they were designed to be implemented, and therefore increase chances, likelihood of finding positive outcomes. Here's the pre-test and immediate post-test surveys that we provide, risk and protective factor outcomes. We currently have our survey version 5.1. We've gone through various iterations of it. It's been quite a transition. We started with paper pencil surveys, then we went to scannable surveys, then we went to online surveys, and we still offer online surveys and paper surveys. More about that as we go along. This pre-post survey includes 5 risk and protective factor measures, 5 substance use measures: alcohol, tobacco, e-cigarettes, marijuana, and opioids. So what we do is, regardless of what PPW program you use, we cast a broad net and measure 5 substances, because we have seen our programs, even if they're focusing on one substance, let's say alcohol use, we see outcomes on other substances, say, for example, tobacco and marijuana use. Our pre-test and post-test risk and protective factor immediate surveys also include 6 health behavior measures. This is actually the behavioral part to it, the follow-up. So 2 physical activity, 2 nutrition, a sleep, a stress control, health goal setting, 2 perceived health measures, 2 program rating items, and 2 qualitative measures at the post-test. Estimated time to complete a pre and post survey, about 6 minutes for the pre-test, 7 minutes for the post-test. So very efficient. Doesn't take up a lot of time to collect your data. So let's look at the surveys. Let's look at the demographics. We collect today's date, a code number. Now we have a self-generated code number, but that can be changed. We can't tailor these surveys, our online surveys for your use with your population and your settings. So for example, for code number, sometimes we'll change that questions to have students list their lunch code, which they have to use every day and they won't forget. So that's just one example of how we can tailor it. School location, here's another one where you can have kids put in a particular code to identify specific schools or locations, or we've worked with our providers and created a drop down of multiple settings so they can identify what setting they're at. Gender, age, race, these are all demographics that we have that we collect in our pre-post surveys. 5 substance use behavior risk factors, 6 healthy behavior protective factors, and these are measured on a 5-point scale of very likely to very unlikely, and there's 2 examples on the bottom of this chart. In the next 30 days, how likely are you to get physical activity most days a week? That's a behavioral intention item. Behavioral intentions are the most predictive measures of actual behavior, and that's next 30 days. That's a protective factor. If the people are saying yes, they're more likely, very likely to likely to participate in physical activity most days a week. That's a good thing. And we're looking for change over time between pre and post on that 5-point scale. And then the last item is a risk factor, behavioral intentions. In the next year, how likely are you to take a drink of alcohol? So that also behavioral intentions is a risk factor. If they are likely to take a drink, then that's a risk factor. If they're unlikely, I guess that's a protective factor in a way. So both sides of that coin. So those are behavioral intentions. Here's perceived harmfulness, 5 substance use behaviors on a 5-point scale of great deal to not at all. And here's an example of one of those perceived harmfulness items. And perceived harmfulness is very commonly used and measured nationally. I think Youth Risk Behavior Survey measures it, Monitoring the Future measures it for sure. If you were to use marijuana often or heavily, would you harm your health or health habits? And so perceived harmfulness is on that 5-point scale. A great deal, that's where we'd like to have youth be, or not at all. That's the worst case scenario. And so you could see change from pre to post on perceived harmfulness, as well as I said earlier, intentions, behavioral intentions to engage in substance use and the healthy behaviors. Other measures that we offer include likelihood of feeling sad or hopeless, which is a mental health measure. How happy are you with your current physical mental health, which is a perceived health measure? How much did you like the lesson, a program rating? How much will the lesson help you improve your health, a program rating? And then lastly, 30-day substance use and healthy behavior pre-test and follow-up measures, which we'll look at right now. 2 qualitative items, by the way, 2 qualitative items on the post-test. What did you like best about the lesson? For example, how did it affect your healthy habits, your substance use, your motivation, your goal setting, etc.? This item, in their own words, qualitative data, very, very important, powerful, and can be used as testimonials to promote your program, and you can use it as a check against and to help understand better the quantitative data you just collected on risk and protective factors. So very important qualitative measure. Another very important qualitative measure is the green one in the green box. What did you like least? So you got what did you like best, positive, promotional item, what did you like least? We'll give you some examples and some ideas about how you can improve your PPW program or any program intervention in the future and give you some suggestions from your participants if you read those comments very carefully. Good qualitative data to round out and support your quantitative data. Very important. And one of the health behavior measures that we have on the pre-test and the end of semester 1 to 3 month follow-up post-test, these are the behavioral measures. We get a moderate and vigorous physical activity measure, and eating healthy breakfast and fruits and vegetable measures, sleeping hours, stress control measure. That's actually separate. Those are two separate measures. Setting fitness, health goals, alcohol, tobacco, e-cigarettes, cannabis, and opioid use, and feeling sad and hopeless. All of those are behavioral measures found the pre-test and the follow-up post-test, so you can actually determine change over that period of time. So if your pre-test is at the beginning of the semester, your post-test is at the follow-up post-test is at the end of the semester, most likely that's about a 3-month period. So if you implement your interventions early, you could follow up at 3 months later. If you implement your interventions throughout the semester, then your follow-up may be as short as maybe a month. But you do need at least 30 days because these are 30-day behavioral measures. If you have any questions about what I'm saying, ask it in the Q&A area because I am going through this pretty quickly. So desired direction from pre-test to post-test. What directions do we want to see these items? So as far as risk factors, we want to see a decrease or an increase depending on which measure they are. So for substance use behavioral intention, so this, which is, do you intend the next year to try alcohol, to try marijuana, to take a puff on a cigarette or e-cigarette? We want those to decrease. We want intentions to decrease or at least stay the same at a minimum, but not to increase. And then, because actually what you'll see, but the reason I said this is most youth, and the younger they are, the greater the majority, have no intentions to use substances. But the older they are, the risk increases, intentions increase, and use increases. The other aspect of that is we expect to see a decrease in the perception of harmfulness. So same time, perceived harmfulness should increase. Sorry about that, I read that wrong. So we should see a decrease in intentions to use, and we should see an increase in perceived harmfulness. That's what we really want to see. And for protective factors, we want to see an increase in intentions to engage in healthy behaviors. With regard to substance use, we want to see either a decrease in actual 30-day substance use or at least staying the same. And healthy behaviors, we want to see an increase in their participation in healthy behaviors. And the healthy behaviors that we measure are physical activity, you saw them, different kinds of physical activity, nutrition, sleep, stress control, goal setting. The instructor survey, now we're going to switch from outcomes to process to quality measure. We have an instructor survey. We ask our instructors, recommend highly that they complete the instructor survey at the end of every program implementation. This assesses the quality of their presentation on a 5-point scale of a great deal to not at all or none at all. So you can see the 7 items that are measured very quickly. It only takes literally a minute or two. Level of comfort during presentation, which can vary from setting to time to population, et cetera. A lot of variables there. Active presentation strategies like good eye contact, voice fluctuation, movement, et cetera. Level of enthusiasm, which we believe is very important, particularly in group settings for our motivational prevention plus wellness programs, because you are trying to motivate young people to engage in health behaviors and avoid substance use behaviors. Level of smoothness or continuousness, accuracy of following the protocol, lesson provided completely, and participant responsiveness. So those are the 7 items, and by completing this, if you as an implementer, whether you're a teacher, coach, counselor, nurse, doesn't matter, student leader, if you're implementing PPW programs, you complete this at after every presentation, you'll be able to monitor the quality of your presentation and the goal. Well, I'll hold off on that. A few other items on this process sheet, which are optional. Which PPW program did you implement? How was it implemented? In other words, virtually, one-on-one, in the group, etc. What did you like best? What did you like least? These are optional items if you want to complete that. Now, instructor survey measure. What are the goals? So what you want to do is you want to reach and you want to maintain the highest score possible, a great deal on as many of those seven items that you measure on your program implementation throughout time. So really the goal is to get to a great deal. What do we talk about by a great deal? We're talking about a great deal in terms of comfort level, active presentation, enthusiasm, and so forth. And we know that that will fluctuate over time, obviously, for various reasons. And then this should be assessed, as I mentioned before, at the end of every lesson you present. But even before that, when you practice the PPW scripts, completing one of these instructor surveys will keep you on track and remind you what's important with regard to quality presentation. So pre-implementation practice, as well as implementing every lesson, you should complete an instructor survey. Fidelity checklist, what does that include? Well, there's pre-implementation steps, implementation steps, post-implementation steps. Pre-implementation includes program implementer training, making sure that your providers have had implementer training, certified as an implementer at least one of our PPW programs, that they practice the script, and that they collect pretest data. Implementation includes following the script, enthusiasm level, implementing the entire intervention in one setting, showing the PPW slides or the PowerPoint slides, reading the goal plan and co-signing it with youth, and then the post-implementation steps are collecting at least the immediate post-test, if not the follow-up post-test, completing instructor survey, a fidelity checklist, and reminding the participant to continue the goal set. So all really important for fidelity. And how do we know if your program's implemented with fidelity? The more items you check off on that fidelity checklist, the greater the level of fidelity. So you want to check off as many as possible. You want to meet as many of those items of fidelity as possible. Greater the list of fidelity, the greater the probability of having positive outcomes. Now, how often to collect your program data? With regard to the pre-test and post-test surveys, collect for every program and every participant. That's what we recommend, if you can. And then you can monitor every month, every quarter, every year, what your outcomes are. How about instructor survey? I mentioned it already, collecting for every program and every lesson presentation at the end of every lesson presentation. You can monitor weekly or, however often you want, but a little bit more often to see the quality. In the very beginning, you want to see that the staff are implementing it with high quality. Midterm, throughout the semester year, toward the end of the year. A good idea to continue to monitor the instructor survey quality of implementation. And for that, how often you want to collect that? Every month, quarter, year, it's up to you. Let's take a look at evaluation designs at this point. There's some evaluation designs. This is a design for your immediate pre-post survey to assess risk and protective factors. So where 0 is the data collection and X represents the program, and you can see number 1, the minimum design would be 0x0. In other words, pre-test, implement your program, and post-test. So if your program, like most of ours, is one session, you do the pre-test, program, and post-test all within a single session. If you use one of our multi-session programs or using some other prevention program, let's say it's 6 sessions long, you do the pre-test, conduct your 6 sessions, and at the end of that last session, you do your post-test. Now, there's a better way to do that data collection, and that is Actually, that should be, that's a little mistake, but better is where you have number 3, actually, I need to correct that, where you have the 0x0, you have one group receiving a pretest program and post-test, and another group receiving just a pretest and a post-test. And then I see there's a little error here. And then a third way is where one group gets pretest program post-test and another group just gets the post-test. In other words, these other 2 options are where you're collecting data on a comparison group. So either pre and post without any program or post without any program. So you have something to compare the youth that received the program. So that comparison it strengthens your evaluation design. I'm sorry about that. I'm going to correct that before I send you those slides because that's a little wonky. But the minimum design number 1 is pretest program implementation post-test. That's to collect your risk and protective factor data. If you want to collect behavioral data, what you're going to need to do is at a minimum number 1 design, you have a pretest and a post and a program implementation with ours because a pretest is very brief. You can do the pretest and complete the program with one setting. And then notice there's a gap there before the post-test. So that's where you collect your post-test at least 30 days later because the behavioral measures of substance use behaviors and healthy behaviors are 30-day measures. So you need to wait at least 4 weeks before you implement that post-test. Now, a better design is number 2, where you collect a pre-test implementation of the PPW program or any prevention program and post-test within that setting or immediately thereafter, and then pause 30 days or longer, could be 2 months, 3 months, 6 months, and then do a post-test of the behavioral measures. So that's an even better design because you actually have one more data collection there. You have an immediate post-test of risk and protective factors and then a longer-term post-test of behavioral measures. And then adding to that, to strengthen that number 2 design is to just add a comparison group, which gets a pre-test and a post-test, but no program in between. That is, that's the most challenging for all providers, obviously, to just do a pre and a post and no programming. But it's ideal in the world of evaluation. That's where you'd have an actual what's called the quasi-experimental design, or if you had randomization involved at the individual level, at the classroom level, or at the school level, then you might even have a randomized controlled design. So those are some designs. There's some real advantages of our online survey versus our paper survey. If you look to the left, the advantages of the online survey: no data handling, so very time consuming, very time saving, I should say. You don't have to handle the data. You don't have to hand enter the data. Another advantage is it increases response accuracy. Young people are more likely to answer honestly in an online anonymous survey than if you're handing them a survey, paper, pencil, and you're there with them. And another advantage is very quick and easy. As we said, 6 minutes for pre-test, 7 minutes for post-test. The disadvantage of the online surveys, it does require that your youth or young adults, whoever you're collecting data from, have to have a device, a smartphone, a tablet, or something, a Chromebook, and then you have to have internet connection so that you can collect the data. You look to the right, the only real advantage of the paper survey is you don't need internet and a device. You just need copies of the survey. So we really encourage as many of our providers to use, if they're going to collect data, use our surveys, to use the online survey. How does this work, this data collection survey procedures. What does it involve? Well, it's display, request. So number one, you display the pre-test customized link or QR code before the lesson. So you request from us, we'll send you a customized link just for your organization. So your data will be separate from everybody else's. You show the pre-test link or the pre-test QR code, whichever works better for you. We can send that to you, and that'll collect your pre-test. Same thing with the post-test. We can send you a customized immediate post-test as well as a follow-up post-test link. You just show those. And then whenever you send us an email to request your data charts, you'll get that. In fact, as soon as you start collecting data, you can send me an email at info@preventionpluswellness.com and say, can we start looking at our data? Yes, I'll send you links and you can track your data. And then at the end of your data collection, we could also send you the raw individual data if you want to do some other analyses. How about comparing pre-test, post-test data? So we offer, as part of our evaluation services, we offer free access, as I just said, to the data, SurveyMonkey data charts, the raw data from the pre-test, from the post-test, from the secondary follow-up post-test. And we do offer free side-by-side comparison of pre-test and follow-up post-test. If you do follow-up post-test, we will definitely do an analysis for you, show you pre and follow-up post-test, and do a little brief report. If you do a pre-test and immediate post-test, sometimes we'll do a free analysis, but it depends on our, what our time schedule is and how many you've collected, and that kind of thing. So we may or may not be able to do that for you. And we also, if you want to order purchase some time from us to do that, we can do that. We do have where you can purchase a report from us, and that increases our motivation to do a report analysis for you. Last box there is, if you partner with us to conduct a rigorous evaluation, that means with a control group or comparison group, your organization can receive free program materials and training. And I'll send you this link, these slides, so you can check more of that out on our website. But to see a sample, just to show you a sample of data, how we do a comparison of pre to post on behavioral intentions to get more sleep. Here's one example. To the left, the question is, by the way, in the next year, how likely are you to get 8 more hours of sleep most nights? And we're just looking at the highlights at this point. Most likely, pre-test 36%, most likely, very likely pre-test 36%, very likely post-test 42%. So that was an increase of 6%. 6% increase, very likely increase in getting more sleep. 6% increase of the number of youth saying that they are very likely to get more sleep most nights. So that's a positive change. There's another example, pre-post comparisons in the next year. How likely are you to drink any alcohol? In the left is the pre-test. We looked at both very likely and likely. And the right, the post-test, very likely and likely. And the difference was 60% decrease in likelihood, both likely and very unlikely, just likely, if you will, of youth that would drink alcohol in the future in the next year. So that's a positive result. 16% less students likely to try alcohol in the future. And one more example, if I drank alcohol regularly, would it harm my health? 16% agreed at pre-test, 24% agreed at post-test, which is an increase in 8% perceived harmfulness. So 8% more participants perceived alcohol use, agreed that alcohol use would be harmful to their health or health habits. We also do case studies of our providers, and we post them on our website sometimes, and we'll identify organizations if they want us to. We won't if they don't want us to. It's up to you. We share these with you. And here's what we did with sport implemented in middle school. This was last year. It was a small sample, 98 participants in the Northeast U.S. And the question is, what is that? Decreases in Behavioral intentions. I can't really see that because of this toolbar. Is that what that is? Behavioral intentions decreases. Marijuana 8% all the way down to e-cigarettes 22%. So from the bottom up, you've got, all with the exception of marijuana, you've got double-digit changes. Alcohol 18%, opioids 19, cigarettes 20, and e-cigarettes 22. And then behavioral intentions decreasing from 9% alcohol down to 27% opioids. So outside of alcohol, most of the changes from marijuana and opioids, two-digit changes, 12%, 19%, 21%, 27%. Those are some sizable, I think. So anything over 5% we usually report. How about behavioral intentions, increases in health behaviors? And you see all of these are double-digit changes from pre to post for practicing stress control relaxation at 16% increase, all the way to 27% increase the number of youth that said they're going to sleep 8 more hours, eat more fruits and vegetables, and 25% said they're going to get more physical activity. As far as perceived health, 13% decrease in feeling sad or hopeless. Very important because this is an indication of mental health. So we're seeing between pre-test and post-test all of these changes from a 45-minute sport intervention with middle school students. And the last item, 33% increase in perceived happiness about their current health from participating in the sport program. I thought that was pretty amazing. 1 in 3 students. Sample online survey charts just to show you what these charts look like, SurveyMonkey charts, because sometimes, unless you've seen SurveyMonkey, you may not know. So here's, one of the questions, how likely to get physical activity most days a week. You can see an actual chart from very likely to very unlikely. Remember, I said that's a 5-point scale. You can see the histogram here, if you will, and you can see the percentages very quickly if you want to share these with others, very visual. But you also get a frequency count and the percentages of responses as well. And that's the case for all of the items in your pre and post and follow-up post-test surveys with the SurveyMonkey. You get the histograms, you get the frequencies and actual percentages, actual frequencies and percentages, and you can see how some of these responses go. So let's just conclude. There's a lot we covered. There's some really, really important, essential reasons for monitoring and evaluating prevention programs. We mentioned some of them, you mentioned others. Importance for assessing implementation and improvement, promoting your intervention, lots of good reason to determine, to collect data on your program. Now, our programs, PPW programs, include online, which is preferred, but also paper surveys at pre-test, at post-test, and at follow-up post-test, so that you can really monitor outcomes and as well as the instructor survey to collect data on quality of implementation and fidelity checklists. So we have these built-in free assessment tools so that you can assess, even though PPW programs are evidence-based, we believe in data-driven decisions because there are too many variables. You take an evidence-based program and now you implement it in a real-world setting with different people and different levels of training and different experiences and different populations and settings and so on. You're going to get different outcomes. So that's why collecting data and ensuring the outcomes that you need and desire is important. And this is why we've always included free data collection tools in our programs. And I think all prevention programs, you should collect data on. Evidence-based and especially non-evidence-based, but all programs. Online surveys have various advantages to the paper surveys we mentioned. And lastly, monitoring data to ensure high-quality implementation and comparing your pre-test to your post-test will give you, as a decision maker, the important information you need to make sure that your program is getting the outcomes that you want to improve your program over time, and then also to promote your program. So you want to learn more about PPW, there's our website, preventionpluswellness.com. There's a collection of our catalog. I'm not sure that's even live anymore. I have to look at that link. Request program sample there. You could reach us at on our website, preventionpluswellness.com, or info@preventionpluswellness, and there's our phone number. You can call us anytime in St. Augustine, 904-472-5022, and that's it. So I'm going to leave that up in case you want to look at that and jot that down. I'm going to see if anybody had any Q&A, any questions, any Qs. And as I pull this up, I see we might have some Qs. Yes, we got 3 of them. And here's one from Kathleen. What do you advise to help people overcome their fear of evaluation? I did not know that was a thing, Kathleen. I'm sure there's a psychological term for that, fear of evaluation. And I'm sorry to hear that. But I mean, I guess some people are just more, numbers oriented, so might be a left and a right brain kind of thing. But I would say just get involved any way you can, and take training like you're doing, and dip your toe in the water, try to collect some data and see how it works for you, and ask for help. Don't be afraid to ask for help from other professionals who are more comfortable with data and data collection and analysis and so on. And for our customers, we give as much help as we can possibly do to make them feel comfortable. So that's a great question. And then Heather said, one of the problems is key leaders not understanding the importance of allowing a program to be implemented, and they don't want to deal with it or pay for it. Yeah, I'm assuming you're talking about, Heather, the data collection. Sure, absolutely. That's the case. And so I guess there is a need, both you and Kathleen have highlighted the need for continued discussions about the importance of data collection and evaluation. And but the problem is, when you got to sort of be sneaky about it, I'm afraid, because when you use the word evaluation and data collection, automatically, I think a lot of people aren't going to attend. So, for example, this webinar, I mean, we have a good number of people attend, but not the numbers that we would have for, like, say, next month. We're having a webinar on how to increase youth, strength, or I can't remember, reliability, a positive youth development topic. We'll have many more people register for something like that. So I think whatever you can do, Heather, to share your experiences with others, I think is good, because you're right. We really need to help. I mean, data is critical to protecting programs, advancing programs, for all these reasons, and they're so very important. And it's not that complicated. It doesn't have to be that complicated. Kathy said, do you let us know if changes are statistically significant? That's a good question. So what we'll do with our providers is we'll just give you guys the numbers, and you'll see for yourself, what the difference is, both pre and post. And then again, don't forget those qualitative items, which are very, very important. And then we will run case studies, which you can share. Now, as far as running statistical analyses, we are looking for providers that will collect the follow-up end of semester post-test data, and we plan to bring in an evaluation specialist from a university here in Florida that will run those statistical analyses. In this case, it'll be most likely, again, for those of you that are familiar with the jargon, like non-parametric analyses, they'll link the pre and post tests together so they can run more powerful statistical tests. So that's all to answer the question, is this a real change from pre to post? Is it likely due to the program versus just chance? And so that's definitely something we want, and sometimes we will do that, particularly with the um, the follow-up post-test search. Now, for the media pre-post, we don't do that, but you can get the raw data, and you're welcome to run those analyses if you have somebody that can do that. That may mean that there's a need for us to do that for our customers. I'm not sure, our clients. Let's see. Then Deacon says, how can we get the certificate participant? I'll send you a link today, and then you'll be able to get the certificate for attendance for today, as well as the recording of the webinar and today's slides. And those are all great questions. I really appreciate it. Let me just double check, make sure there wasn't a question in the chat space. Sometimes we'll get a question. I'm going to go to the very end of that. Some people are saying thank you. Oh, if you use student Chromebooks for completing the survey, do you think that the student answered honestly? We have school personnel suspecting students are concerned that the answers could be linked to their Chromebook. Well, that is Tina, that's a good question. I mean, if you compare again online surveys, technology surveys versus paper surveys, there's a distinct advantage. But if they are getting that idea that there's some kind of an identifier to the Chromebook and the Chromebook is linked to an individual, then yes, that can really have an impact on what's called social desirability to answer honestly. So what you need to do as a data collector, as an implementer, is to tell students that there is not that link, or if there is that link, nobody's looking at that this is a completely confidential and in fact anonymous data collection. You want to emphasize that to enhance the quality and accuracy of your survey response. I didn't know that. That's really a very insightful comment. I didn't know that was possible. I'm not sure that it is, but the fact that students might think it is could influence their honesty of it. And you want them to answer as honestly and accurately as possible. And you want to emphasize that before they complete their pre-test, post-test, and follow-up post-test surveys. Parents also should know what the outcomes are, I think so. And that was what somebody had mentioned earlier. So one more, I think maybe one more, or did we see this last Q&A? I want to just double check. That's it. You've done a great job. Thank you for participating. I'll make these couple little corrections on our slides, post them, send you a link today. You'll be hearing from me. Thank you all for what you do. God bless you for your work with youth, with families, with communities. If we can help at Prevention Plus Wellness, let me know. We will be having, like I said, future webinars. So go to our website, preventionpluswellness.com, and then the banner on top, drop in your name and email so you get notified of upcoming webinars. Thank you guys. Have a wonderful day. Keep up the good work.